are a number of inequities, from the availability of medication to the availability of practitioners and availability of testing for the purpose of ruling out secondary causes of headaches. And the striking thing about these disparities is that they're not just subtle. They can be really extreme. For example, if you look at the density of neurologists, who are the specialists most aligned with treating headache disorders, especially complex headache disorders, the density of neurologists in low-income countries, many low-income countries, is so much less than the density of neurologists in high-income countries. The difference can be over 100-fold. And that is shocking. It's not 2 times, 10 times, 150 times when you think about a number of low-income countries. And I think it's striking. I think it's embarrassing. And I think there's an imperative that we all work on that. And, there's been a lot of publicity for disparities in healthcare for life-threatening illnesses like infectious diseases, cancer, heart disease, etc. But I think headache disorders, being one of the most disabling and one of the most common groups of illnesses in the world, deserves similar attention. And it really, like I said, really is striking. So there are a number of different categories of barriers to these to solving these inequities. I would say the biggest barrier to working on reducing disparities in care for headache disorders, the biggest one really is the inequity in general health and the inequity in general healthcare. These are big problems, and they're not going to be easily solved, and I think relate very strongly to inequities in wealth and earning power and housing and all sorts of social determinants of health. And I think it's going to take political will in a number of countries, especially high-income countries, to help adjust this terrible inequity in general healthcare around the world. But when it comes to specific barriers that are prominent in my field, a number of thinkers and authors in the area have broken them into different categories, and I kind of like the following category: barriers to working on disparity that have to do with resources, so testing resources, medication, non-medicinal approaches to headache care, and so on. So availability of resources, and that of course includes clinicians, availability of clinicians who know how to take care of headache disorders. Then there's a category I guess I would call the physician and healthcare worker knowledge base. And even though much of headache care is not that complex and can be done by even non-physician healthcare workers, there needs to be a certain knowledge level at every level of headache care, and this can be really lacking in a number of areas. And then I guess I would say another category would be community or patient-related barriers to achieving equity in headache care, and those would be things like patients' distrust of their medical community and unwillingness to comply with medical recommendations. For example, in some low-income countries, there are some serious potential causes for headache disorders, like infectious diseases, HIV, tuberculosis, etc. And it's widely thought of in some of these communities that medical recommendations can actually be dangerous. For example, the recommendation to get a lumbar puncture. And in some communities, of course, headaches are thought to be mostly psychological. And so some of these misconceptions need to be worked on. I think developing a sense of trust in the medical community is just essential. And these are hard things to solve. I mean, cultures and cultural expectations and cultural beliefs, very hard to reverse. However, I think can be done if one can build bridges between community leaders and publicize how patients can be helped quite a bit by medical intervention for headache disorders. The solution to the knowledge base issue, I think it's not as hard as we've thought. What has been done, of course, in the past is physicians and others have been brought to do fellowships in places where there's a lot of good teaching of headache medicine. And there have been scholarships to attend meetings and so on. But I think what really needs to be done here is education of medical practitioners at all levels, from the initial level, person who might see a headache suffer initially, all the way up to a headache specialist locally, with bringing in good teachers to regions locally based on what those regions need. And I'm making a point of that because I think in the past there's been more of a top-down approach to the sort of knowledge base rectification, and without asking people in the local communities what they really want to know about, what they really want to learn. And I think that there can be a lot of different options for formal teaching. But then there's an option that I think that has been grossly underutilized, and that is, now that we do things like we're doing right now on Zoom, on different platforms, it is no problem to create a forum for case discussions between two groups of people, two individuals even, anywhere in the world. And I would promote a great expansion of opportunities for case conferences, case discussions. And again, I think that when patients get better and they talk about it and people see them now more productive, this will spread like a snowball effect. And in terms of the systemic problems, from general medical health disparities to specific disparities in resources for testing for headaches and resources for treating headaches with medication, these are tough issues. And I think that they're broader than just the medical areas I know about. But I think, again, it takes political will. I think that there can be donations of medications. For example, there can be governmental sponsored testing facilities, maybe mobile facilities that are put into place. And I think that, what will convince policymakers who can do these kinds of things, improve general health and improve the accessibility of headache health, I think what will convince these policymakers are a couple of ideas. One, when you improve headache health, you're putting back into society really more and more productive people who couldn't have been productive when they were struggling with headaches. And it's been shown time and time again that general health in a population is good for an economy. So, I think we need to use these kinds of motivators to adjust policy.